Hi, Mrs. Smith. My name is Michael. I'm here to talk to you about a new medication. Do you have a few moments?
Yeah, sure.
Thank you. So today we're going to be starting you on a medication called apixaban or Eliquis. This is a medication that's known as a blood thinner, and it's used to prevent clots and to prevent strokes in patients with AFib like yourself. This medication is taken orally twice daily. And the dosage that you're going to be on is 5 milligrams. So you're going to take 5 milligrams in the morning and 5 milligrams in the evening.
So am I supposed to take this with breakfast and dinner, or?
That's a really great question, Mrs. Smith. So this medication can be taken at any time without regard for food. And then if you also have trouble swallowing, you can crush the tablets and sprinkle it in some applesauce or pudding or something like that and take it immediately. Okay?
Okay.
So you'll be on this medication, apixaban, indefinitely going forward. It most likely will be a lifelong medication unless there's some changes that happen. So it's important that you take this medication every single day. If you forget to take a dose, that's all right, it happens. But take the dose as soon as you remember. But if it's pretty close to your next dose, I would say within 4 hours or so, I would go ahead and skip that dose and start your normal schedule.
Okay.
Is that clear?
Yes.
All right. So Mrs. Smith, since apixaban or Eliquis is a blood thinner, you'll be at an increased risk for bleeding. So you might notice that you bruise easier, you might notice some blood when you brush your teeth. So we just recommend being careful when moving around, taking your time. Consider utilizing a soft bristle toothbrush to prevent that bleeding. However, we do recommend contacting your doctor if you fall, because you can have some internal bleeding as this is a blood thinner. And then we also recommend contacting your doctor or going to the emergency room if you develop dark tarry stool or you notice some blood in your urine. Okay? Just another thing I wanted to point out, Mrs. Smith, since you're using the Eliquis for AFib and to reduce your risk of stroke, if you do notice any signs or symptoms of stroke, such as one-sided weakness, slurred speech, or blurry eyesight, we recommend going to the emergency room right away to rule out that you're not having a stroke and be treated if you are, just in case. So this drug Eliquis or apixaban does have some drug interactions. So before you start any new medications, whether they be over-the-counter supplements, herbs, or prescription medications, we recommend contacting your doctor or pharmacy just to let them know what medications you're taking and to make sure that there's no interactions. Okay. We recommend storing your Eliquis or apixaban in a cool, dry place. So we don't recommend putting it in your bathroom due to the humidity, and keeping it in a safe place away from children and animals as well. All right.
Okay.
And what questions do you have for me, Mrs. Smith?
That was pretty clear. Thank you so much.
Of course. And before I go, would I just be able to have you explain back to me how you're going to use this medication and how you'll be taking it?
Yeah, so it's Eliquis. It is a blood thinner. I will be taking it twice a day. It's 5 milligrams. If I fall or hurt myself, call my doctor. I may expect some bruising as side effects, and storing it in a cool, dry place.
Great. And Mrs. Smith, what are you going to do in the event that you miss a dose?
Take it as soon as I remember, and I'm not sure. So
Take it as soon as possible when you remember, but if it's close to your next dose, then go ahead and skip it and resume your normal dosing schedule.
Okay.
All right? And feel free to call us at SWC Pharmacy whenever if you have any questions or concerns.
Okay, thank you.
All right. Thank you, Mrs. Smith. Enjoy the rest of your day and feel better.
Thank you. You
Take
too.
care.
Bye-bye.